Now, Christmas is just around the corner, but there's another C word that nobody wants to hear at this time of the year, and that's, of course, COVID. This most unwelcome of guests has hampered festive celebrations in recent years. But should we be concerned this time around? For example, here in Singapore, mask wearing is being strongly encouraged in crowded areas, with a new JN.1 variant driving up cases. The Ministry of Health talks about an increase of 75% compared to the previous week, with over 50,000 cases recorded between the 3rd and the 9th of December. Public hospitals are now building contingency plans, as well as opening a new treatment facility in an expo hall. Singapore, of course, isn't alone in this situation, as many countries, including the UK, see a spike in numbers. Well, earlier we heard from Professor Claire Bryant, who is a professor of innate immunity at the University of Cambridge, who started by explaining what is driving this new infection.
The appearance of this new variant is a potential driver of this, but probably the key factor driving up cases at the moment is that, unlike in previous years where we've had wide coverage of the strong vaccination campaign, not as many people have been vaccinated. So here in the UK, for example, the vaccine rollout has been restricted to the over 65s or people who are particularly susceptible. As a consequence, of course, that means there's less immunity in the environment, which means that the viral cases are going up. And also, of course, in the UK, it's cold, unlike where you are. And so we're kind of all trapped inside, and therefore that's an ideal situation for the virus to spread. So those are the predominant factors, and add into the mix a new variant coming along as well. Then we've got the right kind of conditions in order to drive another peak.
What do we know about this new variant? Is it making people sicker? Is it as contagious as before?
Yeah, I think that's a little hard to describe. We know it's a sort of grandson of Omicron. We know it's got some mutations that are slightly different. We know some of those mutations are in the spike protein, and the vaccines have all been generated against the spike protein. So it's possible. It's got mutations in other places too. So it is possible that it will be more transmissible, more spreadable, more infectious. It's also possible that the mutations in the spike protein means it can stick on to body cells more easily and therefore potentially be more infectious. But before we all panic, we should still have some immunity from our vaccines. Now, if you haven't been vaccinated recently, you won't have so many antibodies, but it's likely that the JN.1 may not be quite as sensitive to the antibody binding because of the mutations in the spike protein. However, we do still have T cells, and these are special cells in the body. They come out, and what they do is they bind onto and kill any body cells that are infected with the virus, and those should still be functioning. So even if you haven't been vaccinated recently, you should still have, if you've had vaccines in the past, you should still have some degree of immunity against the virus. So therefore, we shouldn't see a big burst in hospitalizations. Hopefully that will not be the case. And if you have an opportunity to get vaccinated, then obviously getting vaccinated is a great strategy to help reduce disease risk from this virus.
Aside from vaccinations, is there any advice that you have? For example, mask wearing, does that help still?
Yeah, it does. I mean, I think it's something that in Asia people are much more sensible about this, and they're quite happy to wear masks. So, unfortunately, it's not quite as popular in the UK and the States, but certainly masks wearing, particularly in crowded places, or if you're getting on a plane, and lots of people are traveling at this time of year. That will help. Good hygiene, washing your hands, all the kind of things that we were encouraged to do during the pandemic is a great idea. I've just travelled back from the States and I wore a mask the whole way to protect other people as well as myself because I'm just recovering from a cold. So these kind of things are sensible strategies to do to protect other people as well as yourself.